Good morning. I want to call the Committee of Education and Health to order. I'd like for the clerk to please call the roll.
Madam Chair, you have a quorum.
Thank you very much. I tried to wait until a few more people came in, but I think we need to go on and get started because we have quite a full docket this morning. And if we can find out if Delegate Hope is on the line, we have somebody who's here to testify on behalf of that bill and will not be able to stay very long. So if we can call up House Bill 2166 first, that will help to facilitate movement of this calendar. And so can you find out if Delegate Hope is on the line?
Madam Clerk, the delegate is on the line.
Okay, Delegate Hope, good morning. Welcome to the committee. You have House Bill 2166, involuntary admission. Good morning. Go right ahead.
Oh, the House Bill 2166. Boy, when you said I'd be the first, I was the first. This is the mandatory outpatient treatment bill that's before you. This has been a stakeholder work group that has been affiliated with the Deeds Commission, but it was headed by the Department of Behavioral Health and University of Virginia. This is a process that we've gone through with all different stakeholders. We've had stakeholders from all different, the CSBs, number of different participants as well. This makes a number of different technical changes in reforming our mandatory outpatient treatment program, but it also makes some substantive changes having to do with the length of time that someone can be put in mandatory outpatient treatment up to 180 days. And it also changes in the code, the agreement of the individual to go into treatment. The reforms that you have before you, Madam Chair, is based on national best practices. It's something that we've been looking at for a number of years, as I said. This has a reenactment clause, or rather, a delayed enactment clause, I should say, of July of 2022. The reason why we did that is because there is going to be a reorganization that we're taking a look at our entire code section related to mandatory outpatient treatment and the mandatory inpatient treatment that we have. And so that work group will continue, and we want all these things to align. The other reason why we did the delayed enactment clause, Madam Chair, is to give an opportunity for our court system and our CSB system to be getting training staff to prepare for this law to go take effect at that time. And that's the bill before you, Madam Chair.
Thank you. Any member of the committee have any questions of Delegate Hope? I think we may have somebody in the queue who is not going to be there very long and we'd like to hear. No, we're not? Okay, fine. Questions of the committee? It's been moved and properly supported that the bill be reported. All in favor of that motion, please signify by voting on the electronic voting board. Clerk, close the roll.
Ayes 13, no 0.
Ayes 13, no 0. The bill is reported. Delegate Hope?
Yes, Madam Chair.
While you're still here, I didn't want you to have to come back. You have another bill that's identical to Senator Barker's bill, and that's House Bill 1913. Could you please go on and report on that bill?
Yes, I will. House Bill 1913 allows healthcare providers licensed or certified by the Board of Medicine, Nursing, or Pharmacy to participate in the program called Safe Haven, which is currently a wellness and fatigue program for physicians and physician assistants. Last session, I believe Senator Barker did too, passed a bill that was enabled the Medical Society of Virginia to create a wellness and fatigue program for physicians and physicians assistants. All this bill does is it builds on that existing law that simply authorizes those providers licensed or certified by the Board of Medicine, Nursing, and Pharmacy to also participate in the Safe Haven program. And it also allows the students in medical nursing and pharmacy schools to receive those benefits as well. I'll point out to you that it has an emergency clause, and to your point, it is identical to Senator Barker's bill, and I'm not aware of any opposition.
Thank you. Any questions from the patron? Can I get a motion? It's been moved and properly supported that House Bill 1930,
Madam Chair, we do have some public comment on this.
the bill is in good shape. Okay, there's a motion on the floor. All in favor of reporting the bill, please designate on the electronic voting. Clerk, close roll.
Ayes 13, no zero.
Ayes 13, no zero. The bill will be reported. Thank you very much. Have a good day, Delegate Hope.
Thank you, Madam Chair.
You're welcome. Okay, starting on page 1, in the first block, House Bill 1986 is, that's being re-referred to Finance and Appropriations. It's been moved and properly supported that House Bill 1986 be re-referred to Finance and Appropriations. All in favor? All right. The bill will be re-referred. Thank you.
My apologies.
Oh, that's okay.
It's a recorded vote, ma'am.
Recorded vote, thank you. All in favor, please designate on the electronic voting. Thank you very much. Clerk will close the roll.
Ayes 13, no zero.
Ayes 13, no zero. The bill is re-referred to Finance and Appropriations. Thank you. House Bill 2035 will be re-referred to Rehabilitation and Social Services. It's been moved and properly supported that the bill be re-referred to Rehabilitation and Social Services. Please designate it by voting on the electronic voting panel. Clerk, close the roll.
Ayes 13, no zero.
Ayes 13, no zero. The bill is re-referred to Rehabilitation and Social Services. Thank you. In the next block, we have bills that are identical and uncontested. These bills have passed unanimously from Education and Health to the Senate floor. And the first bill is House Bill 1798, and that's Delegate Tyler. Her bill is identical to Senate Bill 1175, and that's Senator Russ' bill. It's been moved and properly second that the bill, House Bill 1798, be reported. All in favor, please designate it. Clerk, close the roll.
Ayes 13, no zero.
Ayes 13, no zero. The bill is reported. Thank you. House Bill 1873, Patroness Connor, and it's identical to Senator Edwards' bill, brain injury definition. And again, these bills are identical, and so I don't think there's any need to hear any testimony. It's been moved and properly supported that House Bill 1873 be reported. All in favor of that motion, please so designate on the voting panel. Clerk, close the roll.
Ayes 14, no zero.
Ayes 14, no zero. The bill is reported. And of course, the next bill, House Bill 1913, has already been reported. And now we're going to go to those bills with an emergency on it. House Bill 2204. And this is, the patron is Speaker Phillicorn, and it's identical to Senator Saslaw's bill. It's been moved and properly second that the bill be reported. All in favor, please so designate. This has to go to Finance. Okay, this bill is going to be reported and re-referred to Senate Finance. All in favor of that motion. Did I get a second on that? Okay, all in favor of that motion, please so designate on the voting panel. Clerk, close the roll.
Ayes 14, no zero.
Ayes 14, no zero. The bill is reported and re-referred to Senate Finance and Appropriations. Other identical bills, and this bill is contested, and this House Bill 1904, Patroness Jenkins, and the identical bill is Senate Bill 1196, Senator Locke's bill. And I don't know whether there is any, Senator Locke, could I get you to refresh us on that bill just a bit, if you don't mind?
This bill simply requires teacher, principal, and division superintendents to have a program of cultural competency, and this was a recommendation of the African American Commission.
Thank you, Senator Locke. It's been moved and probably second that House Bill 1904 be reported. All in favor of that motion, please so designate on the voting panel. Clerk, close the roll.
Ayes 8, no 6.
Ayes 8, no 6. The bill is reported. House Bill 2123, patron is Delegate Lopez, and it's identical to Senate Bill 1387, Senator Bosco's bill. And again, this bill is identical. Any questions by members of the committee? If not, I'd entertain a motion.
Second.
It's been moved and second that the bill be reported and be referred to Senate Finance. All in favor of that motion, please so designate on the voting panel. Clerk will close the roll.
Ayes 9, noes 5.
Ayes 9, noes 5. The bill is reported and re-referred to Senate Finance.
Thank you.
House bills similar to Senate bills, beginning on page 5, conforming substitutes and amendments for consideration will be posted to LIS prior to the start of the meeting. And of course, you all have probably already reviewed that information. The first bill is House Bill 1790, and the patron is McNamara, and that bill is similar to Senate Bill 1132, which is Senator Sutherland's bill. Any questions by members of the committee? Then I will entertain a motion.
Move to report.
Do I get a second? It's been moved and properly second that House Bill 1790 be reported. All in favor of that motion, please designate on the voting panel. Clerk, close the roll.
Ayes 14, no 0.
Ayes 14, no 0. The bill is reported.
Madam Chairman.
Senator Cosgrove.
Having voted on the, never mind, I didn't. Somebody else has to. Never mind, I can't. I voted the wrong way on it.
Which bill was that, Senator Cosgrove?
I'm good, thank you.
Okay,
Sorry.
thank you.
Madam Chair,
Senator Howell?
I'm just wondering if in this block we're supposed to be conforming them to our bills?
Conforming substitutes and amendments. Yes, that is correct.
But not the last one.
Not the
Madam
last
Chair.
one. Yes.
The first bill, we do not want to conform it to our Senate bill due to just a technical difference. But the rest of them, you all can consider whether to conform.
Okay, thank you.
Okay, yes. I thought I read that out to the committee, but let me just go back and remind you all, House bills similar to Senate bills in this block, except for the first bill, will be conforming substitutes and amendments for consideration. And as I indicated before, it was posted on LIS prior to the start of the meeting, and you all probably should have been able to review that prior to this meeting. Moving on to other bills similar, House Bill 1808, and that's patronage O'Rourke, and it's similar to Senate Bill 1154, and that's Senator Favola's bill.
Madam Chair,
Senator Cosgrove?
would a motion be in order to conform?
Absolutely.
Then I so move.
It has been moved that this bill be conformed, and all in favor of that motion, I would please ask you to designate on the voting panel. There was a second, wasn't there? Yes, I thought there was. Okay, please designate your preference on the voting panel. I think our panel might be frozen.
An aye.
Does anybody?
Amendments? Are we accepting? It's accepting a substitute. Yeah, it's a voice. It's just a voice vote.
Okay, okay, that's going to be a voice vote. All in favor of that motion, please designate aye or nay.
Aye.
Aye.
Nays have the same right. Thank you. The bill is conformed. Now, that was the motion I was looking for. I hear a motion and a second that the conformed bill be reported. All in favor, please say aye.
Aye.
Those opposed have the same right. Thank you. The bill will be reported as conformed.
Madam Chair, my apologies. We need to do a electronic vote.
Okay, let's go back and do that correctly. Uh-oh, my panel has gone out. I need some IT assistance here.
There we go.
I have nothing.
Mary Ann?
There we go. Thank you.
Ayes 14, no zero.
Ayes 14, no zero. The bill is reported as conformed. Okay. House Bill 1918. Patron is Delegate Mugler, and that bill is similar to Senate Bill 1169. Senator Norman's bill.
I move to conform and report, Madam Chairman.
It has been moved and properly seconded that the bill be conformed and reported. All in favor of that motion, please so designate on the voting panel. And that's 1918. I know on the screen we're seeing 1808, but we need to move to 1918.
Pardon me 1 second, ma'am. I'm having some technical difficulties.
Thank you. Yes, we did. Yes, we did. We first conformed it, and then we moved to. Yes, for 1808, we did that one.
Yes, ma'am.
Okay, we have a parliamentary question here.
Madam Chairman, I withdraw my motion to conform and report, and the motion would be to conform.
Okay. It's been moved and probably seconded that the bill be conformed. And we're going back now to 1808.
No,
Okay.
we did that one.
No, I'm sorry. I'm sorry. I'm 1918. Okay, the first motion is to conform House Bill 1918 to Senate Bill 1169. All in favor of that motion, say aye.
Aye.
Nays have the same right. Okay, now I need to entertain a motion to report.
I move to report the bill as amended.
That is correct. So there's a motion and a second that the bill be reported as conformed. All in favor of that motion, please vote on the voting block.
Madam Chair,
Yes?
this is Delegate Mugler. May I ask a question?
Your building's in good shape. I don't know why you would want to do that, but go ahead.
I know that there was a second component in my bill. I just wanted to make sure that was included in the conformity.
It is here.
Very good.
Thank you.
Thank you
Have a
much.
good day.
Thank you.
No, it wouldn't be. Not if it was conformed to Senator Norman.
Madam Chair.
We have a parliamentary question here. Senator Locke? Okay, I think, some clarification. I'm going to turn to legal.
Sure, Madam Chair. This bill is similar to SB 1169, which is Senator Norman's bill. Delegate Mugler's bill, in addition to requiring that a student provide evidence that he possessed a valid driver's license or driver privilege card before being issued a parking pass, also requires that the Department of Education create a standard application form for that process. And then her bill also requires that driver education programs include instruction on the dangers of distracted driving and speeding. So if you all conform her bill to Senator Norman's bill, those extra pieces will drop off and the bill will go to conference for them to decide how to deal with it.
Okay, all right. Let's go back and correct how we did that. No?
Yeah,
Okay.
Madam Chairman,
I think, just listening to the consensus of the committee, we're going to just conform the bill and let's work it out in conference. So have a good day, Delegate Mugler.
Yes, ma'am. Thank you.
Did you want to vote?
Yes.
Ayes 14, no zero.
Ayes 14, no zero. The bill is conformed and reported, and all of the issues will be worked out in conference. Thank you very much. House Bill 1940, Delegate Rasul, and that bill is similar to Senate Bill 1439, Senator McClellan. And again, this bill is going to have to go to conference to work out any differences that the patrons may have. And so I need a motion to first conform. It's been moved and probably second that the bill be conformed. All in favor say aye. Noes have the same right. Now I'd like to have a motion to report the bill as conformed. It's been moved, probably second, that the bill be reported as conformed. All in favor of that motion, please so designate on the voting panel. Noes have the same right.
Ayes 9, noes 5.
Ayes 9, noes 5, the bill will be reported as conformed. House Bill 2117 has been requested by Finance, and that's Delegate Van Valkenburg's bill, and it is similar to Senate Bill 1313, and that's Senator Mason's bill. And so I need a question, first I need to have a motion to have it conformed, and then a motion to have it reported and re-referred to Finance.
Move to conform, Madam Chairman.
It's been moved and properly second that the bill be conformed. All in favor of that motion, please say aye or nay.
Aye.
I seem to have that motion, and I now entertain a motion to report.
Madam Chairman, I move that we report and refer to Finance.
It's been moved and properly second that the bill be reported as conformed and re-referred to Senate Finance. All in favor of that motion, we need an electronic vote. Please so designate on the voting panel. Clerk, close the roll.
Ayes 12, or ayes 14, no 0.
Did we count everybody? I think that we have 2 people whose voting board is not working. The bill will be reported as conformed and referred to Finance. House Bill 2218, Delegate Hayes' bill is similar to Senate Bill 1333, and that's the chair's bill. And I see that Senate Finance has requested this bill. So I'd like to first have a motion to conform the bill.
So moved.
It's been moved and properly seconded that the bill be conformed. All in favor of that motion, say aye or nay.
Aye.
I seem to have it. Now I need a motion to report the conformed bill and re-refer it to Finance. It's been moved and properly seconded that House Bill 2218 be conformed to Senate Bill 1333, and that it will be reported and re-referred to Finance. All in favor, please designate on the voting panel. Clerk, close the roll.
Ayes 12, noes 2.
Ayes 12, noes 2. The bill is conformed and reported and will be referred to Senate Finance.
Thank you, Madam Chair.
Thank you, Delegate Hayes. Have a good day. House Bill 2206 is Speaker Philicorn's bill, and this bill is before the committee. And Speaker Philicorn, are you available to present this morning?
Good morning, Madam Chair. This is Delegate Kathy Tran, and I'm going to be presenting the bill for the Speaker.
Please proceed.
Thank you so much. House Bill 2206 temporarily allows working families with young and school-aged children who have household incomes up to 85% of the state median income to enroll in the Child Care Subsidy Program. This eligibility increase is targeted to families with children ages 0 to 5, but the child care assistance will be available to all children ages 12 and younger in an eligible family. So what this means is that if you're a family in Fairfax County, which I represent parts of, earning $75,000 per year, you would now be eligible to apply for help paying for childcare until July 31st, 2021, and would remain eligible for at least 12 months or until your income exceeds about $88,000. This pandemic has disproportionately impacted women and families. And as we all can recall from the 2020 December jobs report by the U.S. Bureau of Labor Statistics, women accounted for the total net lost jobs of 140,000 jobs that month. The availability and accessibility of childcare is going to be key to our ability to economically recover from the pandemic. And this bill uses the Federal Emergency Child Care and Development Block Grant dollars, so it does not tap into any general funds. If you have specific questions, I know David Carey, I believe, is on the line to help answer questions about the Child Care Subsidy Program.
Thank you, Delegate Tram. I'd first like to turn to the committee to see if the committee has any questions. Okay, we'll turn to the Speaker. And We're going to limit speakers here because I see that this bill came out of the House 99-0. So if I'll give you 1 minute to respond to the committee. And
Madam Chair,
the clock is running, and in 1 minute you will be silenced.
Emily Griffey, please go ahead.
Good morning, Madam Chair, members of the committee. I'm Emily Griffey with Voices for Virginia's Children. We support this effort to help more mothers into the workforce and to provide affordable, accessible early childhood education. Thank you.
Thank you very much for that very brief report.
Next, we have Grace Reef.
Hi, I'm Grace Reeve, and I'm with Child Care Aware Virginia. And we, wholeheartedly support this bill. New census data that just came out yesterday for all states, including Virginia, shows more than half of families with kids have lost income since March. 200,000 parents are out of work because they either don't have childcare or they don't have school for their kids. This is really important to get people back to work. It's really important to ensure parents have access to childcare.
Thank you so much for your support. Thank you. Have a good day.
Madam Chair, there are no other speakers.
Thank you.
Madam Chair.
Yes. Senator Suderline.
I'm trying to understand the eligibility provision. It appeared to me that what the House Senate said 85% of the state median income, and I didn't think that we were that high that it would be the number that was quoted. Am I in error?
I'd like to turn to our legal staff to respond to that question.
Senator Suderline, could you repeat the end of your question? I didn't catch it.
Yes. It was presented that the numbers would be in the mid-70s and that people would remain eligible until they were in the mid-80s. And when I look at the bill, it seems to indicate that it's not to exceed a family state income of 85% of the state median income for a family. And so I would think that my understanding of where we were on that number, it would be lower than the numbers we were told. I'm just trying to see what the actual number is.
Senator Suderline, I only know that it's up to 85% of the state median income. If someone from the Department of Social Services might be on the line, they might be able to better answer the question.
Do we have someone from administration online who could respond to this question, or Delegate Tram?
Madam Chair, my understanding is that the way that the program works is that it's by region, what the threshold is by region. So that example was specific for Fairfax County. And so it might be different in other parts of the state.
Senator Suderline, does that satisfy your question?
I'm just trying to find in the bill where it discusses that, if someone could direct me to it.
Senator Barker may have a response for you, Senator Suderline. Senator Barker, could you please respond?
Well, I was focused on lines 13 and 14 in the bill that says the family's income does not exceed 85% of the state median income, not the locality's median income.
Senator Suderline, does that satisfy your question?
Yes, thank you, Madam Chair, but thank you to the senator from Southern Fairfax. So that would make it less generous than previously mentioned.
Madam Chair?
Senator Barker?
Yeah, just a question of Delegate Tran. I thought I heard that it was $75,000 for qualifying here, as long as you didn't exceed $75,000, but you would be eligible until $88,000. Whereas on lines 13 and 14, it should be 85% of the state median income to qualify. And on lines 22 and 23, it says until the family's household income exceeds 85% of the state median income, which would suggest that the figures should be the same rather than two different figures. Do you have an explanation for
So I am looking, and I was wondering if David Carey is on the line, but I'm looking at a document that the Department of Education has shared with me, state income eligibility scale for childcare subsidy, and it's by family size. So it does, so like the example is if you have 2 children in this example, it seems like it's a little bit different by family size, but I did misspeak and you're right that it is in totality, what the medium income is and not by region.
Hey,
I don't know if
I'm
David.
yeah, I'm sorry. So I've sorry guys, I've had my hand raised for 5 or 6 minutes here, but here I am now. So basically, what that was is that's the for a family of 4 basically. So the 85% would for a family of 4 would be $7,412 per month is how that was calculated. So that for a family size of 1. The 85% state median income would be $3,853 per month, and that's not regional. That's statewide. And we also have on the line Rebecca Ulrich from the Department of Education too, who's logged in if there are further questions about that. But the reason that was set at 85% is because that's the max exit limit for the Child Care Development Block Grant funding.
Thank
So
you.
yeah.
Thank you for that response, but I'm looking at the electronic screen here, and I do not see another hand raised. Do you, Archie, do you all have someone else?
I see Rebecca. So Rebecca's now popped up on the screen there from DOE.
Okay, that's why I'm looking at the screen and I don't see someone else, so I think maybe you responded to the question?
Madam Chair, Rebecca is in the Zoom room.
Archie, I don't see a hand raised here.
Madam Chair, her hand is down, but she is in the panel already.
Okay, then I'd like for her to go on and speak. Thank you.
Good morning, everyone. Just to provide a little bit of clarification, and I'll keep this brief, current eligibility for the child care subsidy program is in fact regionally based, as Delegate Tran said. So the current income thresholds range from 150% of the federal poverty guidelines to 250% of the federal poverty guidelines, again, based on the cost of living in different areas of the state. This bill expands initial eligibility, so eligibility when families apply for assistance, to 85% of the state median income, which is the maximum allowable income under federal law for this program. 85% state median income does vary by family size, as Delegate Tran said. So it ranges from about $89,000 for a family of 4. But again, that is based on family size. So it'll be lower for a family of 2, larger for a family of 6.
Thank you so very much for that clarification. Really appreciate that. Any other questions from members of the committee?
Chair.
Senator Donovan?
I'm just curious if any of the speakers can respond. In this block grant from the federal government, is it capped at a certain amount so that the same pot of money will be distributed amongst more people? Or if we have more applications, will we get more money from the federal grant so that everybody that applies and is eligible will get the benefit? And I have a follow-up question after that.
Good question. David, would you want to respond to that question?
Sure, and Rebecca could back me up on this too, but that there is a child limit set by the state that can be adjusted if we need to allow more families in. And also to clarify, this is this block grant also just received an additional infusion of cash of resources from the most recent stimulus passed in December. So I think the speaker's intention was to take advantage of new federal funds that would be available, and by our calculations, they would be sufficient to cover this, and if needed, we could use additional CCDF dollars, but hopefully that answers that question. And Rebecca Ulrich again is still on.
Follow-up question?
Follow-up question from Senator
and I have
Donovan.
one more follow-up. Have we historically used the full amount of these funds, or have we left some on the table in past years?
Prior to the pandemic, between 2018 and 2020, we had made a lot of progress in using an additional sort of percentage of our CCDF dollars. So we were nearly maxing those out or taking the greatest advantage possible. During the pandemic, what we've seen is a historic drop in the number of families choosing to participate in the subsidy grant. Folks, for whatever reason, we're doing some work to study this along with the agencies here. Our parents are deciding not to enter the subsidized childcare programs right now, and so we are working to. So essentially, for right now, we are not using it, but because of a lack of participation to its full ability. But we've made it available at least to use as much as possible.
And Madam Chair,
That's concerning. Follow-up question from you, Senator
final
Donovan?
question. How are families going to know about this? Obviously, an enormous number of families have had to get childcare. They didn't have it before because they had school for their children. How are we going to make sure families know they have this resource available so that they have the ability to offset some of this terrible expense they've had in the last year?
That's a good question, and I think we've relied on for years in this field a lot of great partners. You heard folks like Voices for Virginia's Children, Child Care Aware. There are groups like E3 and VUCF. There's a long list of groups who are great partners in this area who have been very involved in this and stand ready to communicate in this and in various regions. The governor and first lady will do their best to get the message out about this, and we can explore other options as well once this is hopefully passed.
Madam Chair, I apologize.
Thank you. I think Senator Donovan has a fourth follow-up
I
question.
know, I'm so sorry. If we want to tell our constituents how to access this program, what would we tell them to do?
That would be likely handled by the Department of Social Services, and so they would enter into this program the same way that folks currently enter the child care subsidy program. It just happens to be available to more people. So the intention here was not to create a brand new program or department or anything like this. This would be through the same Department of Social Services website where families would get resources now.
So they would go to the Department of Social Services website for the state and apply that way, and then their locality would connect with them?
I believe so, and Rebecca Ulrich is on the line here from VDOE.
Yes. Before you respond, I was thinking that they would probably go directly to the Department of Social Services in their locality, but I could be in error. So I'd like to have an answer to that question as well.
So there are a number of options for ways that families can apply. They can go into their local Department of Social Services. They're able to apply online. And I also believe that the Department of Social Services is working on adding the child care subsidy program to the benefits call center, which would allow families to apply over the phone as well.
Thank you.
Madam Chair?
Senator Barker?
Yes. Follow-up question here. Senator Favola and I met with officials from the Department of Social Services and other administration officials a couple of years ago, because what we had was a dichotomy in that we were not spending all the money that we got in the Child Development Block Grant, but we had a long waiting list at the same time, which made no sense. And at least initially, there was nothing done to address this issue, because the monies were being distributed by locality, and each social service agency got its share of the money. And some of the ones had difficulty spending it. Others had thousands of people on the waiting list. So my question is, do we still have people on the waiting list at this particular time, which would suggest that we would at least have the potential here of leaving those people on the waiting list, but taking the additional money we've gotten and providing it to higher income people?
Thank you, Senator Barker. Questions from any other member of the committee? Senator Barker?
No, I'm asking a question.
Okay.
And so I'll add that no, I think we this bill is phrased in a way that this would not take away from folks that currently need it, because that was a concern in the beginning, I know, for the speaker and for our team as well. And I know there was also great progress made prior to the pandemic in this waitlist situation. And for specifics, Rebecca Ulrich is here.
Yes, the Department of Social Services has been working hard to eliminate the wait list. I believe last I spoke with colleagues there, we were down to a few hundred families on the waiting list, and the expectation was that those families would be enrolled if they were still eligible within the next few weeks. So the intention of this legislation, you'll notice that there is a clause that says that the families that are deemed newly eligible under this expanded criteria would not comprise more than 25% of the state established child target. So this gets also to Senator Donovan's question earlier. The child target is set by the state. It's a goal to enroll, as many families as possible into the program, given the allowable or the current set of resources that we have available to us. And because we set the target, it allows us to be flexible to interest from newly eligible families without overwhelming the program with higher income families. So we are, we intend to increase the child target to accommodate for these new families. And can continue to increase or decrease the target based on demand or interest in the program. Again, without crowding out families that are currently eligible and without overcommitting ourselves in terms of the federal block grant that's available to us.
Thank you. Senator Barker, does that satisfy your question?
Not completely, but I guess I'll have to take it for now. So.
Okay, if there are no other questions by members of the committee.
Madam Chair.
Senator Newman?
I think my questions are just more like Senator Barker's, and honestly, it may not be a education health question, maybe a finance question, because I think what we're seeing here is a portion of a program, and then we're reading all the words, and the words aren't what they're telling us, right? Because 85% of state income is not what the program does. It does other things. So I guess, we pass this on to and let Mike and Senate Finance give us the whole picture. We'll better understand. And also maybe to George's question and Siobhan's, maybe we need to look at how we get the information out about this to very low income families so that it is not overcome by those that are higher. So, Madam Chair, that's just my concern.
Thank you so very much. Well, this bill is going to go to Finance. It's been requested by Finance. And so whatever details are still lingering, I think we'll get them worked out there. And so if there are no further questions, this bill has been requested by Finance, and I'd like to entertain a motion. Oh, wait, I see there's another hand. Whose hand is that?
Madam Chair.
I see a hand raised by Grace Reef.
Would you like her to be moved into the room, Madam Chair?
Yes, please.
Okay. Grace Reef is back in the panelist room.
Hi, I just wanted to, add to anyway for full understanding. This is totally a bill that will help those families who don't currently qualify because they're above the current eligibility. The issue really is Congress approved new funding, which is, about $200 million, a little more for Virginia. And they did that in recognition that more families really need assistance at this time. So I just wanted to make sure this isn't to pit one group of families against another. This is really in recognition of the dire need that families need to childcare assistance. And with 85% state median income, that is under the federal law, but also the new money that comes to the state, the new federal law enacted in December gives additional flexibility to go even above that. So Congress really did recognize the great need. Thank you.
Thank you very much. Are we prepared to entertain a motion? I don't see.
I'll move that we re-refer to Finance.
You've heard the motion? I didn't hear a second. It's been moved and properly seconded that the bill be re-referred to Senate Finance. All in favor of that motion, please vote electronically.
We're good.
The clerk will close the roll.
Ayes 13, no 0, abstentions 1.
Ayes 13, no 0, abstentions 1. The bill will be re-referred to Senate Finance. The next section, of course, is the public education section, but before we move on to that, I understand that we have some hands raised in the queue. They had some difficulty because we didn't hear the opposition to House Bill 2166. And so that is so duly noted. And so what we will do is if those individuals are still available, we will have them moved into the chat room, and we will allow the opposition a total of 2 minutes. And at the end of 2 minutes, you will be silenced.
If those members of the public could please raise their hands in Zoom. Madam Chair, we have Colleen Miller.
Colleen Miller, go right ahead. Colleen Miller, are you available?
I'm sorry, Madam Chair, I had not heard you call on me. I think I was in transition when you called on me. This is Colleen Miller. I'm the director of the Disability Law Center of Virginia. And I just wanted to make sure that the committee was aware of the fact that there's not total harmony on this bill, on Delegate Hope's bill. The mental health community has raised some concerns about extending the deadline, extending the length of a mandatory treatment order to 180 days. We've suggested some language to Delegate Hope that might alleviate some of that concern. And he had told me that we might be able to insert that as it goes to finance, but I don't believe that this committee sent the bill to finance. So I'm not sure that we really do have an opportunity to work on it. And the mental health community is especially concerned that this bill removes any kind of agreement from the individual who is going to be subject to this treatment. And I don't think that Delegate Hope and I are going to be able to reach any kind of harmony on that issue. I think that's just a point of disagreement between the patron and the mental health community. But I was hopeful we could work out some kind of agreement on the 180-day length of the order.
The bill does have a delayed enactment clause on it.
That's correct. And as Delegate Hope said, there are a number of things that, thank you, Madam Chair. There are a number of things that we are hoping to reform in the overall delivery of the system. We were hoping that this would not have to be one of them, that we could get this one resolved now.
I want to turn to our Chair of Senate Finance, Senator Howell.
Thank you, Senator Lucas. I resist as hard as I can any efforts to have finance get involved with the details of a bill. Our responsibility is whether we can afford to pay for it. So I would prefer it be worked out at this level.
Thank you, Senator Howell. Does that satisfy? I'm sure that doesn't satisfy your inquiry. However, are there other individuals who would like to speak in opposition? I think we only have a few seconds left.
Madam Chair, there are no other hands raised.
Well, thank you. Well, the bill has already been reported, so we will move on. I just wanted to make sure that we gave the public an opportunity to weigh in on the bill. So we will now move to the public education block. House Bill 1776. The bill has been requested by Finance and is the Patronage Board and is the Board of Education temporary extension of certain licenses. Who's available to speak?
I am Senator.
Delegate Ward, good morning. Welcome to the committee.
Good morning. Good morning. Good morning. And good morning to everyone. This bill, House Bill 1776, simply calls for the Board of Education will grant a 2-year extension of the renewable license of teachers or anyone that is licensed by the Board of Education. At first it was teachers, and then administrators and other superintendents began to call. They wanted to make sure that guidance counselors, principals, everyone was also included. So the bill just asks that anyone who is licensed by the Board of Education to be allowed that extension, because during this pandemic, some coursework was not able to be done. Workshops, training on CPR, they were just not being offered. So with this bill, it would allow that 2-year extension.
Thank you, Chair. Thank you, Chairman Ward. Are there any questions of the patron? I hear a motion to report and a second.
And it needs to be re-referred to finance, it says.
The motion is to report and re-refer to Senate Finance. All in favor of that motion, please designate on the electronic voting panel. Clerk will close the roll.
Ayes 14, no zero.
Ayes 14, no zero. The bill will be reported and re-referred to Finance. House Bill 18.
Thank you.
Thank you, Chairman Ward. Have a blessed day.
You as well.
Thank you. House Bill 1827, Patroness Austin, and Delegate Austin, are you available?
Yes, ma'am. Madam Chair, I am.
Yes, please go right ahead.
Good morning, Madam Chair.
Good morning
members
to
of the
you
committee.
too,
House,
sir.
House Bill 1827, the Board of Education Membership Geographic Representation, is a recommendation from JLARC, and it requires the 9-member Board of Education to include at least 5 members appointed by the governor to each reside in different superintendent regions of the Commonwealth. And the reason for this bill, Madam Chair, is currently there are 4 regions of the Board of Education that are currently not represented. And there are 4 members of the Board of Education appointed from the Richmond District, 1 in Tidewater, 2 in Northern Virginia, 1 in Southwest. And there are 4 regions that are currently not represented. So, Madam Chair, this was a recommendation of JLARC to better represent the Board of Education and the school divisions.
That's pretty clear cut. Are there any questions by members of the committee? Then I entertain a motion. It's been moved by Senator Newman. And second?
Second.
It's been moved and second by Senator Barker that the bill be reported. All in favor of that motion, please designate on the voting panel. Clerk will close the roll.
Ayes 14, no zero.
Ayes 14, no zero. The bill will be reported. Thank you.
Thank you, Madam Chair.
Thank you. Have a good day.
Yes, ma'am.
House Bill 1885, Delegate Simons.
Good morning. Good morning. Can you hear me? Thank you, Madam Chair.
Yes, good morning. We can hear you well.
Thank you.
Thank you.
HB 1885 requires the Department of Education to review how current computer science standards are being implemented for K-12 students. There's widespread agreement between stakeholders that we need more data on how our current computer science SOL standards are working so we can understand the gaps and create a framework for improvement. The review will be foundational when it comes to helping more students enter the tech talent pipeline toward high-paying jobs. Thanks for your time. I'll be happy to take any questions.
Thank you for your presentation. Are there any questions of the patron by members of the committee? Well, this is moving along fairly smoothly. So if there are no questions, I'd entertain a motion.
Move to report.
I just have one question from legal. Yes, I want to make sure there's no public comment before I see there is one hand and it looks like
Madam Chair, Nick Serfis is being moved into the room right now.
Yes, I hear from Nick Surface before we entertain a motion.
Please go ahead.
Nick, are you there?
Yes, Madam Chair, thank you for having me. My name is Nick Surface. I'm the CEO of the Richmond Technology Council. We represent over 160 tech companies in the greater Richmond area, and there's a tremendous tech talent shortage in the area, and we think this will continue to build our pipeline here and within the state. So thank you very much. We support this, and we hope you will too.
Thank you so very much. Would there be anybody in the pipeline for opposition?
There are no more members of the public with hands raised, Madam Chair.
Thank you. So now we will entertain a
Move to
motion.
report, Madam Chair.
It's been moved by Senator Cosgrove and second by Senator Donovan that the bill be reported. All in favor of that motion, please so designate electronically. Clerk will close the roll.
Ayes 14, no zero.
Ayes 14, no zero. The bill is reported. House Bill 1905, Delegate Cole.
Good morning, Madam Chair.
Good morning, Delegate Cole.
HB 1905 comes at the request of the governor and the Deputy Chief Workforce Advisor. After some research, we found that there was a lack of public understanding in the differences between traditional and non-traditional employment arrangements. The impact of this difference affects an individual's access to benefits, rights, and overall financial security. Especially during this COVID-19 relief efforts, many residents were surprised by their 1099 gig economy work didn't qualify them for unemployment insurance and benefits and reliefs. So in response, the Workforce Task Force is recommending a greater education specifically tailored to address the widespread lack of understanding on the implication of gig economy work and eligibility for various benefits. So this would just direct the Department of Education to make sure our middle schoolers and high schoolers are receiving the necessary education as it relates to entering into the workforce.
Thank you, Delegate Cole. Before I go to the committee, I want to make sure that the public gets an opportunity to weigh in. So are there those in the public who would like to speak in favor or opposition to the bill? I see no hands raised, but IT?
Madam Chair, we do not have any hands raised. You are correct.
Thank you. Any questions by members of the committee?
I move to report.
It's been moved
Second.
and second that the bill be reported. All in favor of that motion, please designate electronically. Clerk, close the roll.
Ayes 14, no zero.
Ayes 14, no zero. The bill will be reported. Thank you so very much.
Thank you, Madam Chair, members of the committee.
Thank you, Delegate Cole. Have a good day. House Bill 1998. Patron Delegate Murphy. Are you there, ma'am?
I am. Thank you, Madam Chairman.
Thank you for being here this morning.
1998. I have two bills before you today.
Yes, please go ahead.
HB 1998 is a bill that allows us to cut back on the number of lockdown drills from 3 to 2. These lockdown drills, for a lot of the younger children, they get very confused because they don't know the difference between what's real and what is practice. So the
That's
bill,
true for some adults as well, but go ahead.
yeah, me included. But so what we've talked to the school board, they agreed that this was a good way to go. And so what we want to do is just change this from 3 to 2 lockdown drills and have our younger children not participate in the first 20 days when they're first in school because it's very frightening for them.
Thank you for that presentation. Before I go to the committee, could you let me know if I see there's one hand raised and it looks like it's Michael Malloy?
Yeah, Michael Malloy is with the he's with education and he's here to talk about it.
Michael, please go ahead.
Yes, good morning, Madam Chair, members of the committee. Michael Malloy, Fairfax County Schools. We appreciate Delegate Murphy bringing this legislation. Really what this does is this returns some flexibility to local school divisions. There's still a minimum number of lockdown drills that are required, but this gives local school divisions the flexibility to decide whether or not to go above and beyond that number. And also want to let you know that this actually would return the code section to where it was when it was first implemented in 2013. The original code section required the 2 lockdown drills, one in the first 20 days and one in the first 60 days. So thank you.
Thank you so very much.
There are no other hands raised, Madam Chair.
Thank you. So now we'll turn to the committee. Are there questions of the patron? Seeing none, I'd like to entertain a motion. It's been moved and second that the bill be reported. All in favor of reporting House Bill 1998, please designate on an electronic voting panel. Clerk, close the roll.
Ayes 14, no zero.
Ayes 14, no zero. House Bill 1998 is reported. Thank you, Delegate Murphy.
Thank you, Madam Chair.
Delegate Simon, you had one more bill. I'm sorry, I should have heard from you on both of those bills at the same time, but you now have House Bill 2058.
Yes, thank you. HB 2058 codifies the Virginia STEM Education Advisory Board so that the board can align efforts in science, technology, engineering, and math to create a unified vision regarding STEM. The board will coordinate the language we use around STEM and measure our success so we know if we are really promoting a culture of collaboration around STEM in our schools. This board was a top recommendation of the Governor's STEM Education Commission, which wrapped up its work a few years ago, Making the STEM Advisory Board permanent will be an opportunity to sustain and propel that valuable work and promote the advancement of STEM education throughout the Commonwealth. Thank you, and I would be happy to take any questions.
Madam Chair, there are a number of members of the public with their hands raised for this one.
Thank you. I'd like to hear from the those in support and then those in opposition, and you each have 3 minutes total each side. And at the end of the 3 minutes, you will be silent, so be aware that you have others behind you who would like to speak and govern yourselves accordingly.
First, we have Chuck English.
Good morning, Chairwoman Lucas and members of the Education and Health Committee.
Good morning.
My name is Chuck English, and I am the Virginia STEM Coordinator and member of the Virginia STEM Education Commission. My role is to provide coordination and alignment for the Commonwealth STEM efforts. I'm here to speak in support of House Bill 2058, which formally codifies the Virginia STEM Education Advisory Board. This effort will help provide sustainable leadership to Virginia's STEM ecosystem and consistent alignment for STEM educational initiatives across the Commonwealth, helping ensure that we provide and best prepare a competent and capable STEM workforce. The Commission's work revealed opportunities to improve STEM education in Virginia. One major problem is the inequitable access to high-quality STEM education programs. One central group, a champion for STEM, such as this advisory board, could help address these opportunity gaps to ensure that all children have enriching STEM experiences. I urge you to pass this legislation and implement the #1 recommendation of the STEM Education Commission. Supporting House Bill 2058 is the next step for eliminating inequities in STEM education and building a healthy, robust STEM ecosystem in Virginia. Thank you.
Thank you so much for your presentation. Next speaker.
Randy Pearson, go ahead, please.
Good morning, Madam Chair. Randy Pearson, here on behalf of Code VA, a nonprofit that helps train teachers across the Commonwealth in computational thinking, computer science, and coding. We are in strong support of the bill. We thank the patrons for bringing it forward, and we would ask that you act favorably upon it today. Thank you for your time.
Thank you very much. Next speaker.
Kathy Bircher, please go ahead.
Kathy, are you available?
I'm here, Madam Chair. I forgot to hit unmute. I apologize. I'm Kathy Bircher, Deputy Secretary of Education. The administration strongly supports this bill, and we thank Delegate Simons for patroning the bill and also her long history in supporting STEM education. You heard the explanation of the bill. Governor Northam established this advisory commission in 2019 through executive order. They sunsetted in September of 2020. They created a 73-page report of recommendations. Their #1 report was the permanent establishment of this advisory board, specifically to address all of the other recommendations they had. Their top concern across the Commonwealth, which is no surprise to all of you who are consistently looking at this type of information, is the lack of consistency and available programs across the Commonwealth in an equitable fashion that allows all students to have access to high quality STEM education. The administration strongly supports this legislation, and we ask that you act favorably on it today. Thank you.
Thank you very much. We're down to 18 seconds, so if there are others who are in favor, I would like for you just to give us your name of your organization, and tell us that you're in support, or if there are others available.
Susanna Steen.
Good morning, Susanna Steen with Micron Technology. I'm also a member of the Virginia STEM Education Commission, and I support the HB 2058.
Thank you very much. Time has expired. Now we will hear from the opponents. I'm sorry if there are others, but we need to move the agenda forward. So if the other members in queue, we'd like to hear from the opponents of the bill at this time. 3 minutes is your time limit.
If anyone opposes the bill, if they could please digitally raise their hands. And Madam Chair, I see no hands at this time.
Thank you so very much. Now I turn to the committee for any questions or responses that you may have.
Madam Chairman.
Senator Cosgrove.
Thank you, Madam Chairman. About 15 years ago, I chaired a STEM study for the General Assembly, and this bill would go a long way to implementing a lot of the recommendations. I think it's a great bill, and I move to report.
It's been moved and probably second that House Bill 2050 be reported. And of course, Finance has requested this bill, so I'd like that to be included in that motion.
I amend that motion. Yes, ma'am.
It's been moved and probably second that the bill be reported and referred to Finance. All in favor of that motion, please designate electronically. Clerk, close the roll.
Ayes 13, no zero.
Ayes 13, no zero. The bill is reported and referred to finance. Thank you, Delegate Simon. I see you have a big smile. Enjoy your day.
Thank you, ma'am.
House Bill 2119, Delegate Keem.
Yes, ma'am. Madam Chair?
Yes,
And members.
go right ahead.
Yeah, good morning. Thank you for your time.
Good
House Bill
morning to you as
21
well.
Yeah, thank you. House Bill 2119 was requested by my local school division, and there is a representative in the waiting room if you need to hear from him. If not, we can move on. But the bill was requested because there's a little technical issue that our local division is facing based on a code section, which I'm sure it was an inadvertent issue that we didn't think through when we adopted this a few years ago. For those the students that take in-class driver's education at school, for Planning District 8 and Planning District 8 only, there's also a requirement that there's an in-person component where a student has to bring a parent to the classroom for the in-class program that deals with abuse, substance abuse, drunk driving, etc. And so that's been in the code for a while. It turns out that there are some students who might not have a parent for a number of reasons. And so because the code language specifically says parent, it's hard to get around that requirement. And so we end up having situations where some students have to wait until they turn 18 years old before they can get their license, even though they qualify for all the means. And so this would basically fix it by adding a couple of categories where those students that don't have a physical parent that they can be with can also be able to take this class. That's basically what the bill does, and I'd be happy to answer any questions.
Thank you, Delegate Keem. I see that there's a hand raised, and it looks like it's Michael Malloy. So if you can
Yes,
move,
ma'am.
I think you might be wanting to speak in favor of the bill. IT?
Michael Malloy, please go ahead.
Yes, Madam Chair, members of the committee, Michael Malloy, Fairfax County Schools. Delegate Keem did a great job of explaining the situation that we face. We do have, on occasion, with this requirement, have students either who have already turned 18, so who are already adults, or who are either an emancipated minor or they might be an unaccompanied minor, who aren't able to complete their driver's education with us until they turn to the age of 18. And even then they have to go through the adult licensure process. So this just helps to facilitate the driver's education process in our region.
Thank you so very much. I will now turn to members of the committee for any questions or responses. Then I'd like to entertain a motion.
Move to report.
It's been moved and properly second that House Bill 2119 be reported, and it's not asked for by finance. You've already voted. Thank you very much. Clerk, close the roll.
Ayes 13, no zero.
Ayes 13, no zero. The bill is reported.
Thank you, Madam Chair and members.
Thank you very much. I want to take this bill out of order and go to, I see Speaker Herring is there. So I want to skip over a few bills and go to the speaker. To the leader, Leader Herring, and to hear you on House Bill 2111. And of course, your bill has been requested by Finance. Well, will you go ahead, ma'am?
Thank you, Madam President and Madam Chair, and thank you for the brief promotion. I appreciate it. This 2111 is the Maternal Health Data Task Force bill. As we're aware, in 2019, the Maternal Mortality Review Team from the Virginia Department of Health did a review, and of course, there were disparities found with maternal health, especially as it relates to Black women and other women of color. While white women are likely to die of accidental overdoses or suicide, Black women are dying at high rates with maternal mortality. So this bill establishes the Maternal Health Data Task Force to understand the reasons for the disparities. And so basically the task force will evaluate state-level data sources from all stakeholders, including payers, all available electronic claims data to examine the quality of race and ethnicity and other demographic and clinical outcome data. It will examine barriers preventing the collection and reporting of timely maternal health data from all stakeholders. It will examine the current maternal health benefit requirements and determine the need for additional benefits to protect the health of birthing people. and develop recommendations for standard quality metrics on maternal care. The bill is supported by the Virginia Hospital and Healthcare Association, Virginia College of Emergency Physicians, the Medical Society of Virginia, American College of Obstetricians and Gynecologists, the Virginia Academy of Nutrition and Dietetics, and Families Board. And I hope that you support the bill.
Thank you, Madam Leader. I'll get it right. I see several hands raised, and I'd like to hear from those who are in favor of the bill. And I don't know how many are opposed to the bill, but each side has 3 minutes. And so if those in support, you have your hands raised, you will be moved into the chat room. And the first person to speak, RT.
First, we have Becky Bowers-Lanier.
Good morning, Becky. You have a total of 3 minutes, and there appear to be other speakers lined up behind you, so please be mindful of the time and govern yourself accordingly so that others will have an opportunity to speak. Thank you. Go ahead.
Good morning, Madam Chair and Madam Leader, for this bill. And my comments are totally in support. I represent the Virginia Midwives Alliance. I think there was a technical issue with the enactment clause, and I had sent the leader an email about this earlier, didn't hear back. And then this morning it dawned on me, and I have sent you another email to make the technical change. It would be on line 29 about the composition of the midwives on the task force. And I don't know if we need to deal with that now or if you can present it later on, but it would be making sure that the 3 types of midwives in the Commonwealth are equally represented. And my colleague Julianne Condry, who represents the Virginia affiliate of the American College of Nurse Midwives, also agrees with this. Thank you.
Thank you. Thank you very much.
Next is Catherine Gilly.
Morning. I apologize. My video isn't working, but I'm Catherine Gilly with the Virginia Hospital and Healthcare Association. We strongly support this legislation and appreciate Leader Herring for bringing it forward. Thank you.
Thank you, Catherine.
Next, we have Tanisha Griffin.
Tanisha Griffin.
Good morning. Good morning. This is Tanisha Griffin with New Virginia Majority. We support this bill and we thank Leader Herring for bringing it forward. Thank you.
Thank you so very much.
The last speaker is Olivia Turner.
Olivia Turner. Olivia, are you muted?
I'm here. Can you hear me?
Yes, we can. Go right ahead.
Yes. Thank you, Madam Chairman and Leader Herring. I wanted to thank you very much for this bill. VSHL does support the idea of this bill. It makes a lot of sense that we should be helping women and our healthcare by getting more information and providing that information to our physicians and to the public in general. This is exactly the direction we need to be moving in. And again, I want to thank Leader Herring for taking up the opportunity to do this. It will benefit so many women in so many ways. Thank you.
Absolutely. Thank you.
There are no other hands raised, Madam Chair.
Thank you. There are no hands raised in opposition either? Okay, then I'd like to entertain a motion, but just be mindful that this bill has been requested by Finance.
I move to report and refer to Finance.
It has been moved and properly removed and that the bill be reported and be referred to Finance. Second? All in favor of that motion, please designate electronically. Clerk, close the roll.
Ayes 13, no 0.
Ayes 13, no 0. The bill is reported and referred to Finance. Have a good day, Leader Herring.
Thank you, Madam Chair, Madam President. Appreciate it.
You're very welcome. I see another chair in the on the screen. Delegate Tyler. Chairman Tyler.
Good morning, Madam Chair.
Good morning.
And the members of the committee. Yes, I am before you this morning with House Bill 2305. House Bill 2305 is before this committee at the request of the Secretary of Education, Mr. Connor, who identified that there is no current statewide guidance or regulation on the governance of academic year at governor's school. Madam Chair, there was a work group over the summer of 2020 that included the Secretary of Education, the governor's school administrators, senators, delegates, alumni, school superintendents, and the Board of Education. The mission of the work group was to determine what could be done to enhance diversity, equity, and inclusion at all government schools, focusing on creating a middle school pipeline for underserved and underrepresented students. This bill simply charges the Board of Education to include identifying best practices to ensure Virginia government schools maintain accessible pipelines to preparation, effective communication, strategies for attracting a diverse range of prospective students, and a robust diversity of equity and inclusion program. The Board of Education will work with relevant stakeholders that would include local region school boards, regional governing school boards, and all other groups as they develop the guidance. I hope the committee would pass the bill, and here to speak to the bill at the appropriate time is the Secretary of Education, Mr. Connie.
Delegate Chairman Tyler, I'm sorry to interrupt your presentation, but this bill had already gone to subcommittee, and it has been requested to return to the subcommittee on public education so that we can entertain more comments there. And so I'm going to ask the clerk.
So, Madam Chair, HB 2305 was re-referred to Rehabilitation and Social Services.
Delegate Tyler?
Yes.
Chairman Tyler, I want to thank you for your presentation, but your bill has been re-referred. I'm going to hear from council.
Madam Chair, if you want to send this to the Public Education Subcommittee, that meeting is this afternoon. So I just want to make everyone aware of that, not Rehab and Social Services, but our Public Education Subcommittee.
Yes, I have Public Education Subcommittee. It's where the bill is being re-referred. And Delegate Tyler, that committee is going to meet this afternoon. And so, do you have a time? I'm going to ask legals.
Public Education meets 1/2 an hour after adjournment.
Okay. That'll be fine.
Thank you, Delegate Tyler.
All righty. Thank you so much.
Have a good day, Madam Chair.
Thank you.
So, Madam Chair.
Yes.
We would need to reconsider that and pull it.
No, it's going to public education. Of this committee, it's going to public ed of this committee. Right.
Yes, ma'am, but we voted for it to go to rehab earlier. That was the.
Was it to rehab? No, I don't think so. Okay, all right. Now, so what we're going to do is have this bill recommitted to the Subcommittee on Public Education, which will meet 1/2 hour after session today. Are we all clear? Okay, do I need a motion on that? It's been moved and probably second that the bill be re-referred to the to the Subcommittee on Public Education, which will meet 1/2 hour after session this afternoon. All in favor, say aye. Aye. All right, thank you. Next bill up is, let me see, I don't see any other chairs in queue. I don't think. Okay, Delegate Mugler. I don't want to skip anything.
Thank you, Madam Chair.
The next bill is 2314. Delegate Mugler.
Yes, ma'am. Speaking to House Bill 2314.
Yes.
The purpose of this legislation is to bring the Board of Education's regulations governing special education for children with disabilities in Virginia to align with the U.S. Department of Education, Office of Special Education, non-regulatory guidance related to independent education evaluations. This legislation expands independent education evaluations for parents. The revision responds to the Office of Special Education Programs differentiated monitoring and reports and supports letter, that was issued this summer to the department and fulfills its required action item. This legislation basically results in removing the word component, following the word evaluation technically. And this was brought to me by the Secretary of Education.
Thank you so much. I'm looking to see if there are any hands raised. IT, could you assist me? I see none on my screen.
I also see none, Madam Chair.
Thank you. I'll turn to the committee for any questions you may have. There's a motion to report. Do I hear a second?
Second.
All in favor of that motion, please designate it electronically. Clerk will close the roll.
Ayes 13, no 0.
Oh, did Senator Sarslaw leave his proxy? Close the roll. Ayes 13, no 0. The bill is reported.
Thank you so much, Madam Chair, and members of the committee.
Thank you so much. Have a good day.
Hello? This is he. Okay, I'm at my home committee meeting, education and health, but
Thank you. We have a few more bills left, and we're going to turn back to page 13 with House Bill 2182, and that is with Delegate Wilt.
Thank you, Madam Chair. I guess you can hear me.
Yes, we can hear you well.
Thank you, Madam Chair, committee members. House Bill 2182 requires the Board of Education to amend its regulatory definition of traumatic brain injury for the purpose of the provision of special education for children with disabilities to include an acquired injury to the brain caused by a medical condition, including stroke, anoxia, infectious disease, aneurysm, brain tumors, and neurological insults resulting from medical or surgical treatments. And the current code only has what qualifies there are injuries from external forces. Madam Chair, committee members, kind of the backstory of this, there was a JLARC study that said we needed to clean up that language. So where the problem can be, Madam Chair, is when parents of these children go to try to get them the appropriate educational needs that they require because of the injury, because of the narrow definition previously. Sometimes they just run into problems, and I don't want to paint a picture, Madam Chair, that they don't ever get it. The proper education. It's just that, the loops that they have to jump through to get it. It causes a lot of trouble, and since there could be situations where they get the wrong type of education. So that's pretty well it, Madam Chair. I had a constituent. That's where the idea first came from, and she experienced that with her son that had an injury. Like I described, it's included in the bill, and so that's the bill, Madam Chair.
Thank you for your presentation. I see a hand raised, and it appears to be Annie McDonald.
Madam Chair, Ann McDonald is being moved into the room. Ann, if you could go ahead and unmute and go ahead, please.
Yes, thank you, Madam Chair. I'm Ann McDonald, as I said, Executive Director of the Brain Injury Association of Virginia, and we stand in support of the bill. We have heard of other situations in which children's therapy services have been limited because of a diagnosis that's not related to brain injury.
Thank you for your presentation.
Next is Michael Asip.
Good morning, Madam Chair. My name is Michael Asip, and I am speaking in support of Delegate Wilt's bill from the Virginia Council of Administrators of Special Education.
Amanda Morris, please go ahead.
Amanda, unmute and speak to us.
Sorry. Okay, can everybody hear me now?
Yes.
Okay. Hi, Madam Chair and committee members.
Good morning.
My name is Amanda Morris, and I'm requesting the amendment for you all to vote as this current definition of traumatic brain injury has affected my son personally. When he was born, he contracted meningitis at 1 week of age. He was in and out of the hospital with hypoxia for probably the first year of his life. Because of the current definition, my son has been placed in 4 different educational categories, in three different educational settings, under different categorizations. Well, none of them necessarily together treat brain injury or support brain injury as a whole definition. So currently he's being homeschooled. The CDC explains that different parts of the brain play a role in child's ability to function. Symptoms experienced by children with TBI, regardless of cause, are often complex, requiring multiple methods of management. This definition is not inconclusive of all children with medically documented brain injuries. My son suffers from an acquired brain injury, which is medically documented and even has medical support behind it as far as what his educational needs should be, or however the definition limits his ability to receive these services. So as you vote in this bill, please think of my son and the other children who are unable to obtain appropriate educational supports related to their brain injury based on the cause of impact rather than the severity. Thank you.
Thank you so much. I don't see any other hands raised, but if there are others who would like to speak in favor of the bill, we have 30 or so seconds left. If you could just say your name, the name of your organization, if there are any. IT?
Madam Chair, there are no other speakers in the queue.
Thank you so very much.
Madam Chair.
I turn to the members of the committee. Senator Cosgrove?
Thank you, Madam Chair. I'm looking at the bill. Since I'm neither a lawyer nor a doctor, can somebody tell me what a neurological insult would be?
Is there anybody from the administration available to respond to that question, or shall we get it from council?
Madam Chair.
Senator Peterson.
Senator Peterson, I'm sorry.
I think a neurologic insult actually is not a derogatory term directed at our chief executive, but I think would be some type of blow that would concuss the brain, cause the brain to shake within its housing group.
Thank you. I appreciate it.
Madam Chair, this Delegate Wilt, I think Ms. McDonald could maybe speak to that.
Yes, sir. Thank you. Neurological insult does also include those causes that would be covered in this bill, which include acquired injuries that might include something like meningitis or a brain tumor or a stroke, an aneurysm. It's any sort of damage that is done to the brain, either by an external blow, which is what the current definition supports, but as well, it would also include internal mechanisms like a stroke, like a brain tumor.
Thank you so much for that clarification. Turning back to the committee, any questions of the patron? I hear a motion to report. Did I get a second? It's been moved and properly seconded that House Bill 2182 be reported, and I don't see that.
Oops.
My apologies, ma'am. I cleared the board because I pushed it before you were done with what you were doing.
Yes, I'm done now. Okay. All in favor, please vote electronically. And now my computer. Please don't close it. IT, don't close.
I will update your vote, ma'am. Or your yay or nay? I did close the vote.
Oh, it's closed. Okay, all right.
And aye? Ayes 14, no 0.
Ayes 14, no 0. The bill is reported.
Thank you, Madam Chair and committee, for your time.
Thank you. Okay, now we're moving into the area of health professions. And the first bill up is Delegate Adams with House Bill 1737.
Thank you, and good morning, Madam Chair, members of the committee.
Good morning.
House Bill 1737 would temporarily enact regulations that maintain the reduced postgraduate clinical experience requirement from 5 years to 2 years for a nurse practitioner to practice independently until July 1, 2022. Nurse practitioners in Virginia are highly qualified health professionals with extensive education and a very limited scope of practice. Decades of data show that nurse practitioners increase access in underserved areas, reduce costs, and improve health outcomes. Prior to the pandemic, Virginia stood alone with the most restrictive transition to practice in the country, ignoring data demonstrating an overwhelming consensus that 2 years is more than enough time for an independent practice. The governor initially lifted these non-safety related requirements in an effort to address the healthcare workforce shortage, the crisis during the pandemic. NPs have answered the call to fill gaps during this time of need. Taking the governor's orders, qualified NPs have created meaningful relationships with their patients and provided high quality care, oftentimes in communities where finding a provider would prove difficult or impossible. Right now, these critically important patient relationships are vulnerable because they are only permitted through the end of the state of emergency, which could end at any time. This puts patients and providers in a precarious position and could lead to significant disruptions in care, especially in underserved communities. Decades of data and experience from dozens of other states clearly demonstrates that a 2-year transition to practice for NPs is significant, has significant benefits for population health and access to care in underserved communities. Some stakeholders have expressed an interest in reviewing additional information from an ongoing DHP study on nurse practitioners in the Commonwealth, which will be published this fall. And I understand that desire, but I would like to caution that this study is limited in scope and will not hold the answers people are seeking. However, in the interest of arriving at a consensus, this bill was modified to include an enactment clause that sunsets this legislation on July 1, 2022. This provides a clear timeline for patients and providers and allows us to give full consideration to the results of the study without disrupting care in the meantime. This is particularly important in rural and underserved areas across the Commonwealth where NPs have stepped up and created patient-provider relationships in areas where physicians are few and far between. Snatching away their ability to practice leaves patients in a lurch, especially when NPs are unable to find a physician for a practice agreement or must pay exorbitant fees to do so. This is a temporary measure and gives us time to have a complete conversation while continuing to keep patients first. Thank you, Madam Chair.
Thank you, Delegate Adams, for that presentation. And I see that there are several hands raised. I want to go to those who are in support of the bill first. I would turn to IT so that you can inform me of whom those individuals are.
First, we have Ashley Apple.
Ashley Apple, are you in the room?
Yes, I am. Can you hear me?
Yes, we can. Go right ahead. Thank you.
Good morning, Madam Chair and members of the committee. My name is Ashley Apple, and I'm a registered nurse and a family nurse practitioner. I'm speaking on behalf of the Virginia Nurses Association, which represents over 110,000 registered nurses in the Commonwealth, and we strongly support this bill. When we prescribe antibiotics to patients, the dosage and length of treatment isn't arbitrary. It's based on evidence that demonstrates patient safety and favorable outcomes. We should use the same measures for health policy. The current Virginia law mandating a 5-year practice agreement is arbitrary. It's much longer than the standard among the 28 other states that grant full practice authority, and there's no evidence to suggest that it improves patient safety or patient outcomes. In addition, it presents a barrier for access to care in medically underserved communities where some of our most vulnerable patients live and work. We humbly ask that you support this bill, and in doing so, ensure that all Virginians have access to the safe, high-quality care they deserve. Thank you.
Thank you. We have 2 minutes left for the remaining individuals in the queue who are in support, so you might want to abbreviate your remarks. Next person, please.
Olivia Newby.
Olivia Newby. Please be mindful of the limited amount of time remaining for the other speakers.
I am Olivia Newby, family nurse practitioner who works in a urban practice that is one of the largest independent. And what I am finding that not enough healthcare providers who are available to provide multiple chronic ailments in terms of patient education, ensuring medication to hit those social determinants, as well as be aware of being that resource in my community to refer. I often meet patients who come in from the large institution who have gotten so big and so technologically overwhelmed that they are running back into our community, and NPs are needed, and we are needed now, not to be delayed in providing critical care.
Thank you so much.
Natalie Snyder.
Natalie Snyder, please join us.
Good morning, Madam Chair, members of the committee. We'd like to thank Delegate Adams for bringing this bill forward. I'm the State Advocacy Director with AARP Virginia, and we did support the governor's action during the pandemic. We would like to see this change made permanent. Our Center for Nursing Excellence fully supports this bill. AARP Virginia fully supports this bill, and we do hope that you will consider moving it forward. Thank you.
Thank you very much.
Clark Barano.
Clark Barano, you have like 15 seconds left.
I'm on the opposite side.
Madam Chair, there are no other speakers.
Please suspend the time. We will begin with the opposition with 3 minutes.
If anybody else is opposed to the bill, if they could digitally raise their hand, and Clark Barano, you can start us off.
I won't take 3 minutes. Thank you, Madam Chair, members of the committee. Clark Barano with the Medical Society, also representing today the ER physicians, the pediatricians, the OBs, the family docs, and just about every other specialty we have. We appreciate Delegate Adams putting the sunset on here to wait for the DHP report next fall. I would say that it is going to look at access as well as make a recommendation as to the number of years required for nurse practitioner independent practice. So it should give the committee and the full body a greater picture of independent practice here in the Commonwealth. With that said, we would just caution moving this bill forward in that it is duplicative of what's already existing. The language that was created actually by executive order this spring from Governor Northam, allowing for 2 years of practice during the COVID emergency, did expire in September. The governor did not see a need to extend that further. Delegate Adams, being a passionate advocate for this issue, then placed it in the special session budget, continuing it until the end of the emergency order. We obviously don't know when that order will end. And given that this bill's and this issue is going to be looked at next January to reflect what DHP gives back to us, it might be worth considering if the bill is duplicative and just already established and perhaps giving it a good kick of the tires further. But appreciate the consideration.
Madam Chair, there is no one else in the queue.
Thank you. I'm going to turn to the committee, but I'd also be interested in knowing if the administration has a position on the bill. Okay, I will hear now from members of the committee.
Move to report.
It's been moved. And second, that the bill be reported. All in favor of reporting House Bill 1737, please designate electronically. Clerk, close the roll.
Ayes 13, no 0, abstentions 2.
Ayes 13, no 0, abstentions 2. The bill is reported. Thank you very much. Have a good day, Delegate Adams. Delegate Adams, no, please don't leave us yet. You have another bill. I want to go on and hear that while you're here, and that's House Bill 1817, and that's the practice of certified nurse midwives.
Yes, ma'am. Thank you so much. And members of the committee, HB 1817 will allow certified nurse midwives to practice in their communities without the exorbitantly expensive and hard to find consultation agreement. As we face mounting healthcare workforce shortages, it is irresponsible to maintain unnecessary barriers to practice. Accessing maternal health care providers is already difficult for many pregnant women, especially in areas that already lack access to care. Across the country, areas that removed these unnecessary agreements saw increase in the number of maternal health care providers and significant improvements in outcomes, including 13% lower odds of cesarean births, 13% lower odds of preterm births, 11% lower odds of delivering a low birth weight baby. This is of special concern during a time when we have large disparities in birthing outcomes, especially for Black women in Virginia, who are 2 to 3 times more likely to die of pregnancy-related causes. Over the last year, certified nurse midwives have stepped up to provide care in their communities, and we must allow them to continue serving. The research is unequivocal. Certified nurse midwives provide evidence-based, advanced midwifery care that is safe and effective. Since the beginning of the pandemic, Executive Order 57 removed these non-safety related regulations, including consultation agreements, so that CNMs could practice despite physician furloughs and clinic closures. During this time, the midwives have had no disciplinary actions taken against them. The national OBGYN groups wholeheartedly support this measure. And we've heard directly from practicing OBGYNs across Virginia about how these measures, such as expanding access to care, address the disparities in the outcomes. To be clear, consultation and collaboration is an expected and necessary part of the practice of clinical nurse midwives. Furthermore, they are subject to rigorous education requirements, which includes being the lead midwife on 35 births and participating in 60, which is a total of 95. They must be deemed qualified and certified to attend births upon graduation. Professional expectations regarding consultation and other healthcare providers is made abundantly clear through their training, certification, and standard of practice, in accordance with our conversations with stakeholders and out of abundance of cautious. This bill also restates that expectation. We're living through the consequences of needlessly restricting the scope of practice of trained and educated health professionals. Our current policy is unproductive, wasteful, and costly. It's time for Virginia to join 28 other states in this country and modernize how we treat our maternal healthcare workforce. Thank you, Madam Chair.
Thank you, Delegate Adams. And I see that there is quite a long line of individuals in queue, and I'd like to move them into the waiting room. And my goodness, the line is growing. But I want you to be mindful of the fact that each side has 3 minutes. I want you to be mindful of the fact that there are others behind you who would like to speak. And when the time has gotten down to 30 seconds, I want those persons remaining in queue on either side just to state your name and say you are in support, or you're in opposition, and no further comment. And if we go over time, you will be silenced. And so we're going to start with those who are in support of the bill first. IT, if you can move them into the chat room, I'd like to begin with the first speaker. And it appears to be Natalie Snyder, is that correct?
Madam Chair, Natalie Snyder is being moved into the room, but if first Katie Page is already in the room, if she would like to start.
Katie Page, if you could go on and start. Be mindful of the fact that you're limited in the amount of time, and at the end of the time, we will cut off all other speakers, so please allow others the opportunity to speak as well.
Of course, thank you so much. Can you hear me okay?
Yes, we can hear you fine. Thank you. Go right ahead.
Thank you. Good morning, Madam Chair, members of the committee. As Delegate Adams already mentioned, our competencies, standards, philosophy, and code of ethics are internationally supported, and midwives are deemed competent prior to certification, which is slightly different than other clinicians, including physicians in the state of Virginia, who are given unrestricted license to practice prior to board certification. There's been concerns shared that related to experience. Experience is most definitely important for practice. However, it does not establish competency or ability to practice for any professional, least of all certified nurse midwives. Midwives who currently have consultation agreements with physicians face the reality that if the physician retires, injures, or moves to another state, or simply decides they're no longer interested in collaborating, those practices must close. ACOG and the American Academy of Physicians and the American Academy of Pediatricians affirm in their statement on collaboration with CNMs and in their jointly developed toolkit on collaboration and team-based care, which is a national guiding document, explicitly state and support that full practice authority framework or independent practice, healthcare providers still collaborate with members of the healthcare team.
Half the time has been expired.
Natalie Snyder, followed by Arshia Kadir.
Good morning. This is Natalie Snyder, State Advocacy Director with AARP Virginia. We did send a letter of support earlier this week to full committee, so I'll keep it brief and just say that we do support the bill and we urge you to vote it forward. Thank you.
Thank you very much. Next speaker.
Arshia, please unmute and go ahead.
I'm in opposition.
Okay, next we have Julianne Condry. Please go ahead.
Madam Chair, members of the committee, on behalf of the Virginia affiliate of American College of Nurse Midwives, we support this bill, which is also supported by the National Black Midwives Alliance, the National Association to Advance Black Birth, Yale University School of Nursing, Shenandoah University Midwifery Program, AARP, and the Association of Women's Health, Obstetric and Neonatal Nurses, and the Virginia Nurses Association, among others. And I cede the rest of my time. Thank you.
Thank you.
Gabrielle Amanuta.
Gabrielle, if you could just give us your name and the organization that you represent, we need to get as many speakers as we can who are in support. We'd like to hear their names. Please go ahead.
Gabriela Matuna, representing Mystic Flow Wellness Center.
Thank you.
Okay, I'm here to highly support this bill because as a community health worker and health educator, I'm seeing the impact that these certified nurse midwives are doing in the community and how the health outcomes are being improved.
Thank you. I'd like for everybody else just to give me your name and say support, please.
Clarice Wardlaw.
Yes, I'm here as a CNM serving in the Black community. I give my full support to this.
Thank you. I'm sorry, the time has expired for the side for those in favor. Now I'd like to hear those in opposition. We've got to move the calendar. So those in opposition, please step forward.
If those in opposition could please digitally raise their hands. First, we have Dr. Aaron Goldberg being moved into the room. Aaron, please go ahead. Aaron Goldberg, please unmute.
Hello, I'm Aaron Goldberg. I'm an OBGYN speaking in part on behalf of the American College of OBGYN Virginia section. Thank you, Madam Chairman and members of the committee. I just want to clarify, we don't necessarily oppose the bill. We just want to speak out and clarify that we do very much support the practice of midwifery and think it's a great model of care for many women, both in the nation and the Commonwealth. We just support a transition to independent practice that would allow some level of collaborative practice at the outset of graduation from a program and set a minimum standard of births that would be collaboratively supervised by either a doctor or a trained midwife. So it's not that we think doctors should be the ones supervising, just a trained practitioner, so that eventually the transition to independence would be assured by a period of time where a certain number of births could be assured in practice. Similar, you might say, to residency for physicians, although I don't think it's fair to compare the training for midwives to physicians, given the different patients that we do care for. I will cede the rest of my time, given the short number of comments, but just to clarify, we support an amendment, we are not in opposition necessarily.
Thank you very much. And I do appreciate the speaker's understanding that we do have a lot of other work that we have to get done, and I'm sorry that we can't entertain the comments of all of those individuals who come forward each morning. With such a long line, if we did that, we'd be here for the rest of the day. Next speaker, please.
Next, we have Arshia, followed by Nicole Lauder.
Good morning, Madam Chair, members of the committee. I'm Dr. Archia Khader. I'm speaking on behalf of the Virginia chapter of the American Academy of Pediatrics in Opposition. It's very important to remember that at every delivery, there are two patients, the mother and the baby. We are very concerned about the potential ramifications of this bill, specifically in regards to home births. Infants are twice as likely to die and 3 times more likely to have seizures and serious neurologic complications during a home birth as compared to deliveries in a controlled setting. Expanding the scope of practice for any practitioner must always be met with an awareness of the safety of the patient first. Our Hippocratic oath is to first do no harm. It's important to recognize that states that have permitted autonomous practice for CNMs have done so with rigorous transition to practice requirements and regulations in place. There's too much at stake to move quickly on this. We would prefer that the committee have the Department of Health Professions study this, as they have with other scope of practice issues, before moving forward. For that reason, we ask that you say vote no on this legislation. Thank you.
Thank you for your comments, and the time has expired. I'm sorry, if there are other members in the queue who have not had a chance to speak, if you would forward your comments, we will have those documented. Now I turn to the committee for any comments and responses that you may have.
Madam Chair,
Delegate Adams.
may I just speak to the comments made?
I think we probably need to move on to the Senate at this point, and then and get their questions, and then come back to you if that's necessary.
Thank you.
Madam Chairman,
Senator Donovan.
I just want to note, somebody that did not get to speak wanted to point out that the Professional Association, I guess, of Midwives recommends 90 births, whereas school accreditation only really covers 20 births. And I think I have to resonate the concern about independent practice from a 2-year training program and 20 births to no collaborative relationship, because I think that speaking from experience, 20 births isn't that many. And so, I think that there's some suggestions that we're going to hear about this bill, but I just wanted to make that comment because Nicole didn't get to speak.
Thank you, and I can appreciate you making that comment, Senator Donovan, but again, I want to reiterate the fact that what we have is when we have 20 speakers in queue, there's no way we can entertain all those speakers and get through our work. And so at some point, we do have to cut off the comment. So with that, I'm going to turn to Senator Newman.
Madam Chairman, I think that we've heard a number of reasons why someone would want to vote for this, and a lot of reasons why we may not. I think in the Senate budget this year, the chairman has in there a number of study points on broad issues related to scope of care and that type of thing, and there's information in there to take a look. And I think in the past, a lot of times on these type items, we've asked the department to actually provide to us the information related to the positive, negatives, and potential other impacts. Oftentimes in these bills, we'll hear that 28 other states are doing it, but we don't know exactly what 28 other states are doing. So, Madam Chair, I would feel much more comfortable about this as at some point we got information back related to what the scope of practice in other states are, and also the potential healthcare impacts, but also how we make sure that this type of product is available more broadly, especially to some of the more rural areas. So I believe it's an item that we very much may want to take a look at, but I would love to take a look at it with more information, Madam Chair.
Comments by any other members of the committee? Delegate Adams, I'd like to have you wrap it up before we make a motion.
Thank you so much. I do want to make a couple things clear. First of all, there is zero expansion of practice in this bill. Secondly, the statistics quoted by Senator Donovan are just plainly incorrect. In order to graduate, there are already 95 births, 35 of which are lead births. So I do want to make that clear that those statistics are incorrect. And then as a request that I heard secondarily from Senator Newman about practice standards, I did send each of you all some charts that show that the malpractice is basically negligible amongst advanced practice nurses, which include midwives. And so this practice has been going on safely. What we're talking about is eliminating a piece of paper that often costs the nurse midwife a fair amount of money. And again, the national ACOG supports this, and our state ACOG does not support it. So I want to just make those points clear. Thank you, Madam Chair.
Thank you very much. I'd like to entertain a motion from the committee. Senator Newman.
Madam Chair, here again, I think that the best way to do it, from my perspective, is to get more information from the Department of Health and health professions and then report back to us and get more information. And Madam Chair, it may not be the will of the committee, but I would move that we plan to send the content of the bill to the department, have them report back to us next year. That would be my motion, Madam Chair.
Madam Chair, I'd second that as well.
Senator Newman, well, there's a motion on the floor now, but I did have a question about whether or not the administration or the Department of Health had an opportunity to weigh in on this bill before now. I mean, why are we sending it to them now when they've had all session to weigh in?
Madam Chair.
Madam Chair.
Madam Chair.
I think I heard legal first, and now I'm hearing Senator Barker. I want to go on with you, Julia.
We can check if he's still in the room, but Jay Douglas, who's the executive director of the Board of Nursing, was planning to be on the call, and he may be able to answer questions.
Yes, I'd like to hear from him, please. because I'd like to know what the administration's position is, because I don't want to just send the bill back. If administration had an opportunity to weigh in on this bill all session and we've not heard anything, I think it's a bit late now for us to talk about referring it back to get more comments from them. They've had the entire session to do that, Senator Newman.
Madam Chair.
Madam Chair.
Senator Barker.
Yes, the standard practice in a lot of these situations where we're looking at expansions or changes in terms of what the regulations are for various health professionals is to refer the issue to the Department of Health Professions, which then during the year does a study of it, involves stakeholders in the process, has they have their various boards that review these types of things, and they issue a report, and then it comes back the next regular session of the General Assembly with that report and can address it at that time. I think that the current regulations have been around for a good while, and do allow a fair amount of latitude in terms of how what the situation how the situation can evolve over time. But I think it would be worthwhile following the recommendation and the amendment offered by Senator Newman and the administration. I mean, I'm chair of the Health Professions Subcommittee, which this did not go to, but I've not received any indication from the administration that they have taken a position on this bill.
Madam Chair.
Senator Donovan.
I just want to say, in those earlier statistics, I was literally reading from something that had been texted to me, so I don't have any firsthand experience in that. I am very supportive of midwifery and introduced a midwifery program to the hospital where I work. And I think the concern I have is there is not, kind of a consensus on this, which is what I think Senator Barker is attempting to achieve. And the concern that's been expressed to me by pediatricians particularly is the not having a bridge between a 2-year training program and independent practice. And the bridge is not in any way designed to demean anybody, but just really to make sure we've covered all the issues. And so I think that I can't answer the question, about whether or not it's okay to make this decision, but I think the Department of Health Professions can, and they are our subject matter experts that usually come back with a well-informed opinion of how to move forward safely, and I would support the decision to have this looked at by the Department of Health Professions.
Well, I'm going to take the prerogative of the chair to say that this would not be the direction that I'd like to take. I was delivered by a midwife, and so were all my sisters and brothers. And I know that this is something that's very important to a community like mine.
Madam Chair.
And so I don't especially support the motion, but the majority rules.
Madam Chair.
I don't know who's speaking.
It's Peterson.
Peterson.
Yes,
Senator
ma'am.
Peterson.
Yes, ma'am. I just want to say, and I realize I'm cautious about speaking on health professions because I'm way outside of my lane. I defer to Senator Donovan and Senator Barker, but it is frustrating whenever we get these scope of practice bills. There's always pushback.
Yes,
always
always.
pushback. And this delegate has done an extraordinary job of marshaling statistics and graphs, and I've actually been going through it while we've had this hearing. And, it seems to me this is a reasonable step. We're always told to defer it to this committee, to that committee, this commission, that commission, this administration, that administration, the International Tribunal on Doctors, I don't know. But I think this is a reasonable step. But again, I'm an amateur here, so I support you, Madam Chair.
Wait a minute, I got to exhale for a minute.
Madam Chair, I'm exhaling with you. I was also delivered by a midwife.
And the motion was?
Senator Newman had made a motion, which I seconded.
Okay, then we'll take that motion up first. The motion is to refer to the health professions.
Right.
And so let's do electronic vote, please. The motion on the table is to refer it to the... That was not what I heard. Steve, what was your motion? Senator Newman?
Mr. Madam Chair, it was to report the content to the committee, and the bill will probably stay in the belly of the committee, but it will send the content to the health profession so we can get more information. Madam
Okay,
Chair.
I want to just get a clarification from the clerk. Okay, if this motion fails, then we can go to the motion to approve the bill, right? To report the bill. All right, well then we will vote on that motion first. All in favor of the motion by Senator Newman and second by Senator, I think it was Suderline?
Madam Chair? Madam, was it?
Okay.
Madam Chair?
All right, I hear that. So I'll hear from the clerk.
Yes, ma'am. So the motion is being made to refer it to a subcommittee?
Is the PBI with a letter which, yes, that was his motion. Am I correct?
Madam Chair, that really is technically the only way to do it. So the clerk is correct, but it would get the content to the department. Yes, ma'am.
All in favor of that motion, please vote electronically. No.
Ayes 5, noes 10.
Ayes 5, no 10. That motion is defeated. Can I entertain a second motion, please?
Move to report.
It has been moved and probably seconded that the bill be reported. All in favor of that motion, please designate electronically. Those opposed have the same right.
Ayes 12, noes 3.
Ayes 12, noes 3. The bill is reported.
Terrific, Madam Speaker. Thank you, members, so much.
Thank you. Have a blessed day. House Bill 1953, patriotitis.
Thank you, Madam Chair.
Go right ahead with House Bill 1953.
Thank you, Madam Chair. There is an amendment in the form of a substitute.
It has been moved and seconded that the substitute be agreed to. All in favor of that motion, please say aye.
Aye.
Those have the same right. Okay. Delegate Goditis?
Thank you, Madam Chair. Madam Chair, this bill establishes a licensure for certified midwives in Virginia. It also includes a work group at the suggestion of the Department of Health Professions to study the licensure and regulation of certified nurse midwives, and certified professional midwives to determine the appropriate licensing entity for such professionals. We already have certified nurse midwives. This bill creates a certification for certified midwives, but the education is identical. They master the same core competencies, sit for the same board exam, and have identical scopes of practice. As was discussed in the previous bill that came before the committee, midwives provide a really valuable resource. We have a shortage of maternity care, and with the rates of maternal mortality and morbidity, infant mortality, the adding more maternal health care providers can only be a good thing, Madam Chair. The amendment ensures that certified midwives have prescriptive authority identical to that of certified nurse midwives. And Madam Chair, the bill does not change the consultation agreement requirement, the relationship with physicians. I believe there are people here to speak and answer questions that might be
there are.
over my head.
I see several people in the queue, and I will entertain motions, I will entertain comments from those who are in support of the bill first, and then those who are opposed to the bill. And you each have 3 minutes, and at the end of your time, you will be silenced. And so first person in the chat room, IT.
Julianne Condry, go ahead.
Good morning, Madam Chair, members of the committee. On behalf of the Virginia affiliate of the American College of Nurse Midwives, we support this bill, and I'm here to answer any questions. Thank you.
Gabriella Amutana, Tuna.
Yes, good morning. As a community health worker, I can see the big impact, as I mentioned before, that certified nurse midwives and midwives are doing in the community, especially in those communities that are underserved.
That's correct.
I'm talking about our minorities. They go everywhere, and of course the quality and of care that they provide is amazing, and they go above and beyond our patients' expectations. So I highly support this bill. And another thing that I wanted to mention is that I had the state of Virginia have several certified midwives from other states that cannot practice, and they were doing a lot of volunteer work during this pandemic. And I think they should be recognized as well because they received the same education as certified nurse midwives. Thank you.
Thank you very much. IT.
Madam Chair, there are no other hands raised.
Are there any persons that speak in opposition? I'd like to entertain a motion, comments by the committee, and then a motion, please.
Madam Chairman, may I ask a question?
Senator Cosgrove.
Thank you. Looking at the printout we have, it says it's identical to your Senate Bill 1320, which passed unanimously. But then there's an asterisk that says new substitute from the patron. How does this now differ from Senator Lucas's
I'd like
bill?
to hear from our legal counsel.
Madam Chair, Senator Cosgrove, the new substitute is completely technical in nature and clarifies that these certified midwives have prescriptive authority to prescribe Schedule 2 through 6 drugs. It's a completely technical change that will also be made to Senator Lucas's bill on the House side.
All right. If I could ask the chairman,
Senator Cosgrove.
are you okay with that?
Yes, I am, sir.
All right. Thank you very much. Now move to report.
It's been moved and properly seconded that the bill be reported. All in favor of that motion, please designate electronically. Ayes, noes have the same right. Clerk, close the roll.
Ayes 15, no 0.
Ayes 15, no 0. The bill is reported. Delegate Didas, have a good day.
Thank you, Madam Chair.
Delegate Aird, we have House Bill 1989. Delegate LaSharice Aird. House Bill 1989.
Madam Chair, she is in the Zoom room right now. Delegate Aird, whenever
Good
you're
morning,
ready.
Madam Chair.
Good morning, Delegate Aird. How are you?
Can you hear me?
Yes, we can hear you. Go right ahead, ma'am.
Great. Thank you so much. Madam Chair, members of the committee, before you was House Bill 1989. Madam Chair, this legislation, while originally brought to us at the request of Chesterfield County, it really stands to benefit all localities throughout the Commonwealth. It directs the Virginia Department of Health and local health districts to share data on confirmed cases of communicable diseases with emergency medical service agencies in real time during a declared public health emergency. I think that we've all saw during this period of time how critical it is to have access to real-time information and to ensure that they are as prepared as possible. We just want to assist them in allowing this to occur more seamlessly. Also, we found in the House that the fiscal impact that was originally stated can be addressed through federal grant funds that the Virginia Department of Health is receiving. I'm happy to answer any questions, and I know that we have representatives here to speak in favor of the legislation as well.
Thank you, Delegate Aird, for your presentation. And there are hands raised in the queue. And again, I want to remind those on each side that you have a total of 3 minutes for your entire presentation. Be mindful of those behind you so they might have an opportunity to weigh in their either support or opposition as well. I'd like to turn to IT. Who's first in the queue?
First, we have CJ Stoll.
CJ, go right ahead.
Good morning, Madam Chair, members of the committee. CJ Stolle with Two Capitals Consulting. On behalf of the Virginia Fire Chiefs Association, we appreciate Delegate Aird bringing forth this bill. We believe having access to this information will benefit fire and EMS in the course of their duties, and we thank you for your support.
Thank you very much. Next.
Ed Rhodes.
Ed Rhodes, welcome to the committee.
Ed, please unmute and go ahead.
Thank you, Madam Chair. It's good to see you this morning.
Good to see you as well, Ed.
I'm representing the Virginia Association of Rescue Squads and also the Virginia EMS administrators, and we support the bill and appreciate Delegate Aird bringing it forth and the work that Chief Center did on it also. We ask your approval. Thank you, ma'am.
Thank you.
Matthew Cobb.
Good morning, Madam Chair. My name is Matt Cobb, and I represent the Richmond Ambulance Authority, and we also support the bill and thank Delegate Aird for bringing it forward. Thank you.
Thank you for your brevity. Next speaker.
The last hand raised is by Center L.
Morning, Loy Center Fire and EMS Chief in Chesterfield County. We also support the bill and thank Delegate Aird for bringing it forward. Thank you.
Thank you very much.
There are no other hands raised, Madam Chair.
There being no other hands raised, I'd like to turn to the committee for any questions or responses. It's been moved and properly seconded.
Finance and
It has been moved and properly seconded that the bill be reported and referred to finance. All in favor of that motion, please designate electronically. The noes have the same right. Clerk, close the roll.
Ayes 15, no 0.
Ayes 15, no 0. The bill is reported. Will be referred to finance. Thank you, Delegate Aird. Have a good day.
Thank you.
Thank you. Delegate Bell, you know what? I have you here. I'm sorry I could not have moved you from that section because we're now in the health professions section, but we have, I think, 2 more speakers. Delegate Murphy, and then, I'm sorry, Delegate Bell, but looks like you're right at the very end of the list. I'm sorry. Delegate Murphy.
Thank you, Madam Chair. I have
House Bill 1995.
HB 1995, which is it establishes a rare disease advisory council. I founded the Rare Disease Caucus because I have had so many people come to me saying that we really need to advocate for Virginians whose families have to deal with rare diseases. So this establishes a Rare Disease Advisory Council in the executive branch to advise the General Assembly and other government agencies on the needs of Virginians with rare diseases. It is going to explore health challenges that these individuals face, and it will help secure funding for research and development. The bill will cost $42,716 with additional funds being raised through donations and grants, and it has already been approved by House Appropriations. We believe it's time to establish a permanent institution that will help people understand and advocate for Virginians who deal with rare diseases. And as the parent to a daughter who has cystic fibrosis, I'm really well aware of what it takes to raise and support a child who has health complications. So I hope it will be the will of your committee to pass this bill.
Thank you for your presentation, Delegate Murphy. I don't see any hands raised in queue unless IT has some.
Madam Chair,
I see none.
Jana Monaco has just raised their hand and is being moved into the room.
Thank you. Janet, are you available? Jana Monaco?
Yes, I am.
Go right ahead.
Thank you. Good morning, and thank you, Madam Chair. My name is Jana Monaco of Woodbridge, Virginia, and I am the Virginia Rare Action Volunteer State Ambassador for the National Organization for Rare Disorders, known as NORD. Patients with rare diseases in Virginia face unique challenges every day, and I am the mother of 2 children with a rare disease detectable with newborn screening, including my son with a traumatic brain injury and complex medical issues due to late diagnosis. So I can certainly relate to these challenges. Virginia would join 16 other states to date with a Rare Disease Advisory Council that would help address the challenges faced by patients with rare diseases, their families, and caregivers by providing them a forum for stakeholders across the state to analyze the needs of the rare disease community and make recommendations on how to improve public policy. These states have proven that such a council is an effective way to ensure better government engagement and action on issues of importance to the rare disease community. I thank you for your time and support.
Thank you very much. IT, are there other hands raised in the queue?
No, ma'am, there are not.
Okay, I will turn now to the committee. Any questions of the presenter? The motion is to report and refer to finance. I didn't hear a second. It's been moved and probably second that the bill be reported and referred to finance. All in favor of that motion, please designate electronically. Clerk, close the roll. I'm sorry. Oh, I'm sorry.
Ayes 14, no zero.
Ayes 14, no zero. The bill is reported, will be referred to finance. Thank you for presenting, Delegate Murphy.
Thank you, Madam Chair.
Delegate Bell, I am so sorry. I had no control over your bill being at the end of the list. So if you want to.
Someone has to be last, Madam Chair. I am happy to present the bill.
Thank you for being here. Go ahead, sir.
Yes, ma'am. Madam Chair, members of the committee, this is House Bill 2230, and it springs from a work group that was assembled actually in response to a Senate bill last year, Senate Bill 585, and it addresses another way that special needs Virginians can get some help to make decisions. There's sort of a spectrum. At one end is a court-appointed guardian where you are literally making the decisions for the person. Kind of in the middle would be power of attorney, where they give the power to somebody, but they can always take it back. This is at the other end where you're not taking any powers away, but it would be appointed, and you would then help them make their own decisions. And so you can imagine being in a doctor's office and the doctor speaking very, very quickly, and the person could help by slowing it down, asking questions, explaining it, using a different way or words. The same thing could be in a bank office. What happened was y'all liked the idea. You sent it off to DBHDS. They assembled a work group. They determined what we all thought, which is that it is legal already, but very rarely used. And so they had a list of recommendations that are captured in this bill. This bill would have DBHDS do education and training, assemble some best practices, do literally prepared forms so that people who want to do this but don't have the resources or desire to go through a law office can just do it. They would study ways to avoid abuse and ultimately get back to us with data, making this all available to those going through the guardianship process. Madam Chair, I have a much longer presentation, but you've had a long day. I'm happy to answer questions or talk further at your pleasure.
Thank you, Delegate Bell. I see that there are hands raised, and I would like for IT to move them into the chat room. Those in favor of the bill speaking first. Each side will have 3 minutes.
First, we have Terry Morgan. Terry, if you could unmute and go ahead.
Hello, Madam Chair and members of the committee. My name is Terry Morgan. I'm the Executive Director of the Virginia Board for People with Disabilities, and we support this bill. We believe that information, education, and training about supported decision-making is critical to implementation and furthering the self-determination of individuals with disabilities, and collecting and reporting data on the use of supported decision-making will provide important information, including the efficacy of education and training, health outcomes for individuals using supported decision-making, and reductions in number of guardianship petitions. Thank you very much.
Stephen Burns.
I'm in opposition.
Madam Chair, there are no other hands raised.
Okay, then opposition, you can go ahead.
Thank you, Madam Chair and members of the committee. My name is Stephen Burns. I'm an elder law attorney in private practice, and I'm the co-chair of the Public Policy Committee for the Virginia Academy of Elder Law Attorneys. We're a group that focuses on elder law, specifically guardianship, conservatorship matters, estate planning matters, and such. We did speak out against the support decision-making bills last year. We did have an opportunity to participate in the study over the summer. I do appreciate Delegate Bell's summary of what has happened, because I do believe that's accurate and also a very good representation of what's before you. Our concern continues to be that this is going to be sold as an alternative to guardianship. What is already available in the form of medical directives and powers of attorney are sufficient. The law surrounding those is well developed. We're concerned that this is going to be a development of fill-in-the-blank forms that are going to be sold to families. They're not going to be recognized by third parties, and we're going to be putting people in place who we don't know if they're a fiduciary or a party to a contract. So we're concerned about the exploitation and abuse of the folks that end up signing these, that they're forms that really are ineffective and they end up hurting them. Thank you.
Thank you so much for your presentation. Are there other speakers?
Madam Chair, there are no other hands raised.
Turn now to the committee. Senator Sutherland, I heard your voice first.
Thank you, Madam Chair. I'd like to move to report the bill. Of course.
Okay, the motion is to report
Finance.
and re-refer to finance.
I was
and-
trying to reduce the workload for our finance chair.
Before we carry that motion, I'd just like to ask a question. I know a lot of these bills are going to finance, and I am certainly curious about why we would refer to finance those bills where there's federal funds. Senator Howell, could you please respond to that?
Yes, it's the policy of our staff to request every bill with any fiscal impact regardless of how it's being paid for.
Okay, so even if
And
it's not
that's
being...
just the policy.
The policy is if it has a fiscal impact, even if it's being paid for by the federal government, we still have to refer those bills to finance.
Yes.
Okay, then I want to go on and carry the motion. The motion is that the bill pass and refer to finance. All in favor of that motion? Clerk will close the roll.
Ayes 14, no zero.
Ayes 14, no zero. The bill is passed and will be referred to finance.
Madam Chair, members of the committee, thank you.
Thank you so much, Delegate Bell. Have a blessed day. Unless I'm in error, I see no other legislation to be considered before the committee. I will turn to the clerk to make sure that we're accurate on that.
Madam Clerk, that completes the docket.
That completes the docket, and if there's no further business, the committee will rise.
Madam Clerk. Oh, I'm sorry. Madam Chair.
Delegate Tran.
Madam Chair, were you going to hear HB 2035 today?
Which bill is that?
2035? I thought that was on the...
2035 was referred to Rehabilitation and Social Services. That was the second bill this morning.
Great. I'm sorry, I missed that. Thank you.
Okay.